some of the treatments that you mentioned or therapies, just including diet and oxygen, how important would those be to somebody who's already gone through the traditional radiation, surgery, chemotherapy when, I mean, let's face it, those options are tough on a body. How important would it be for somebody to try those natural therapies after that?
I think it's very important. It's actually crucial because, you know, what happens after conventional therapies, for the people who do recover from cancer with conventional therapies alone, in essence, that you've made the same forces that destroy cancer cells are going to make your other cells more susceptible to turning cancers, whether through respiration damage or through oxidative stress, through DNA damage, right? There's a variety of different things. And it's really important because, you know, a lot of people, once they recover from cancer, a lot of times they go back to their normal lifestyle, right? And unfortunately, a normal lifestyle nowadays is pro-cancer from multiple angles, right? So it's very important, you know, I think myself, like a lot of integrative practitioners, you know, we see a lot of these cases. We see people coming in who had cancer 5 years ago. They beat it with conventional therapy alone. They didn't do any of the dietary changes. They didn't do anything beyond that. And you know, I've seen plenty of cases where it comes back a few years later, and often it comes back more aggressive, right? Sometimes in multiple places. So it's very important. It's one of the most overlooked things in medicine right now. And usually, you know, for those kind of patients, what I do is I put them through kind of a metabolic boot camp, if you will. You know, we kind of address their body as we do someone who's going through cancer in the first place, right? Less aggressively, right? But you know, we'll put them through a boot camp of maybe a few months on, a few months off, cycle them back and forth, and then progressively lower and lower the program. So it's really important. I think if we were to do that, we'd have a lot more success, and you'd see the recurrence rates really, really drop.